So I'm going to give an example at a national level of interface between science and decision, and with the committee which was created after the Scientific Council for COVID-19 pandemic. So obviously, and we have had a very nice presentation from Wanda, one of the lessons of the COVID-19 pandemic is the fact that we have to have a broader view of health interaction between the different healths. And it was also one of the recommendations of the COVID-19 Scientific Council in France, which beside the recommendations, it was given to the French government, the advice given for the course of the pandemic and for the management of the pandemic, decided to make what we call the lesson learned, trying to push for future involvement and collaboration between the different sectors, especially at the different stage of a pandemic situation. So we have talked about that within the prevention part, primary prevention, I would say, preparedness and early detection and response. And for each step, recommendations were given to the French government to implement practical activities and practical collaboration to enhance One Health approach and trying to better prevent and be prepared to the next pandemic. So when the Scientific Council resumed around 2.5 years after the start of the pandemic, the French government decided to create a new permanent committee for monitoring and anticipating health risk. So this committee has some similar characteristic of the one developed by the COVID-19 Scientific Committee, which is consultative, independent, transparent, agile. It was also under the authority of, it is also under the authority of Ministry of Health and Ministry of Research. And the main difference is that the objective of this committee is not to tackle only coronavirus, but health risk in general, infectious disease, and not only infectious disease, but infectious disease in the general context of One Health and implication of climate change and pollution, for example. And the second different characteristic is that there is a aim of anticipating risk and not just helping the government in mitigating and developing action to prevent the burden of the situation. So the COVAS as a mandate had to develop multi-sectorial and multidisciplinary expertise. So it is reflected in the composition of the COVAS, which is 16 scientists from different sectors, human health, animal health, and environment, with different multidisciplinary approach from virology up to human science, including infectiology, immunology, entomology, epidemiology, whatever. Obviously, but also including three representatives of civil society, association and patient, and representative of the citizen, which was very useful for the work we have done. And it was also, the work was also developed with a One Health perspective in the interaction that we have with a different agency, because we have been interacting with human health, animal health, and environmental health agency. Same thing for the research organization, international organizations, and also with the private sectors in the sectors of animal health and human health. Obviously, the work we have been doing was to deliver opinion to the French government related to risk, which were considered to be important by the French government. So in that case, we receive requests from the government, but it was also possible for us to decide of starting a work on a specific disease for which we consider that there was a risk and a need for anticipation and developing research. So you have here the list of the opinion that we have released for the last 2 years. And you can see in bold the ones where we had obviously a One Health approach. So I'm talking about Mpox, vector-borne disease. We had several of them, mRNA vaccine, and obviously avian influenza. Just the example of avian influenza, because that was a subject that we decided to work on in 2023 without any request from the government, but taking into account the situation worldwide with the increased number of avian and mammal species infected with the same clade all over the world. So we did this first report in June 2023, and we did an update, obviously, after the situation in the US with the cattle contamination. And most of our recommendations were targeting integrated surveillance or integrated control of the disease through vaccination of human, vaccination of birds and whatever. So targeting human sectors, animal sectors, and environmental sectors with environmental surveillance, for example. So now I move to the an opinion that we have released earlier this year, which was a very easy one. You know, the question from the government was, what do you think about the main risk that we'll have, infectious risk, health risk, in the coming future between 2 and 5 years? Easy questions. Thank you. And initially they gave us 3 weeks to answer. Okay. So we say no, at least 3 months. And at the end of the day, we took 6 months to have a kind of answer. Because it was not only related to infectious disease, but also to infectious disease, taking into account environmental risk. Hopefully, we were excluding terrorist risk. That was a good thing. So what we have done, we have followed a classical methodology developed by EFSA or other agency for risk assessment. We have defined, according to these questions, specific questions, risk of exceptional, situation in France. We have defined 16 criteria to map this infectious risk, first of all. And criteria were related to epidemiological characteristics, individual clinical characteristic, availability of countermeasures, and also potential impact on different sectors. I will talk about that later on. I'm not going to enter into detail. Everything is available online if you are interested in. So this is a big heat map adapted to the risk, and you have the scoring of 35 infectious risk against these 16 criteria. So obviously blue is low risk and red is very high risk. I'm not going to enter into detail on this table because another representation is easier to analyze. This is this one with the probability of occurrence. Here? No, it's not easy. Huh? Okay, probability of occurrence against consequences if the disease is occurring in France. And you have in the top black square the disease for which we consider that there was a high risk of occurrence and high consequences. So you can see that the top two diseases listed here are pandemic respiratory diseases, with a bit of difference between pandemic influenza and pandemic coronavirus. And when we are talking about pandemic coronavirus, we are talking here on a new coronavirus and not the evolution of the current one. Afterwards, you have the acute respiratory infection with a huge burden and obviously annual recurrence. And then you West Nile virus and dengue. And then if you continue to decrease the level of risk, we have other vector-borne disease like Zika, chikungunya, and Crimean Congo hemorrhagic fever. And we have also listed systemic bacterial infections, resistant tuberculosis, tick encephalitis, Lyme, and Mpox. What is important to notice is that, first of all, you don't see the disease X, because disease X is somewhere, but it's obviously somewhere. If it is a disease X of importance, it will be somewhere in the black square. So perhaps another new coronavirus or another virus everywhere. So what is also important to notice is that we have also evaluated what we consider to evaluate with time after 2, 5 years or even more in terms of increase of the risk. And in green, you have the green arrows, which are representing the increased risk related to environmental factors. And in red arrows, you have the geopolitical and population factors, which could increase the existing risk. And you can see that most of the highest ranked risk are also at the highest level of increase of risk related to environmental factors. What is important is that we have also evaluated the situation in French overseas territories, because the situation is quite different, with different comorbidity, with different interaction between animals and human, because also of permeable borders, for example, between Comoro Islands and Mayotte, and because these territories in the Caribbean and in the Indian Ocean are obviously in interaction with other countries and other disease situations. So I'm not going to enter into details, but just to indicate that, for example, rabies or Rift Valley fever were noted to be more at risk, for example, in Indian Ocean than in other places of France. So what we have also evaluated is impact of the 9 highest ranked infectious disease risk in order to help the government to develop specific control and mitigation measures. So we have separated the impact on healthcare system, the psychosocial impacts, the economic impacts, the impact on ecosystem of the disease itself, and also the impact of control measures. That could be vaccines, that could be the mask and whatever on the ecosystem itself. So that was for infectious disease risk. But the question was also consider also the environmental risk. And that is even worse as an infectious disease. So we have tried to evaluate and score the climate risk, other physical agent, and chemical agent risk, like fine particles or metals or pesticides. But at the end of the day, that was really impossible to have an idea of a ranking of this risk, because you have, let's say, beside air pollution, for example, you have very few studies which indicate the real burden of this environmental risk. And the other thing is that you have a lot of interaction between environmental risk, which are very difficult to evaluate. And the other thing is that also there is, perhaps I would say, not enough collaboration between toxicologists and ecotoxicologists. And this is really needed to understand the risk of the related to environment. But what is sure is that we have indicated in our report that the burden related to environmental risk, it's globally at the same level that the burden related to infectious disease. So you do not have to neglect this risk. And you have here a presentation of the mortality in France per year for the COVID-19. For example, in the peak we had up to 70,000 deaths, which is quite similar to the deaths related to a small particle, which is about 40,000 a year. Moreover, if we are talking about environmental risk, we have highlighted the fact that biodiversity loss, climate change and pollution are obviously interconnected and have all of them direct or in combination, direct effect on human health, which can be studied by syndromic effect, but which have also indirect effect on human health, both by increasing vector-borne, waterborne, foodborne, and zoonotic disease, and by increasing the vulnerability to other infectious disease. For example, chronic respiratory disease related to air pollution will increase the vulnerability to COVID-19 infections. So we have provided a recommendation to the French government related to health measures, research on health risk and preparedness. Again, most of the recommendations were related to organizational process and developing research on integrated surveillance and prevention measure. So again, I'm not going to enter into detail. To finish with 2 slides. The first one is a conclusion related to the evaluation of the health risk. With several bullet points, I want to stress the importance of the One Health approach to assess, prevent, and mitigate health risk, obviously, but also to stress the fact that we need research and multidisciplinary research at each step of the pandemic or of an emergence. We do need scientific-based expertise to help the government to take decisions, but we have also to consider uncertainties. So let's open the risk of the disease X. What we have seen is that zoonotic diseases and vector-borne disease are the highest ranked risk in France. And the infectious disease risk increase with climate change and geopolitical risk. And at the end of the day, as we have said, we do not have to neglect environmental risk and consider, in terms of research and action, the interaction with infectious risk. And my second slide of conclusion is related to the return of experience that we have done or our own committee in terms of interaction between science and decision. And what were the key factors which were enabling us to provide recommendation to the government, which were taken sometime or not. The first key message is that we had a direct link with the highest level of the government, with direct interaction with the ministries at an interministerial level, interaction with the ministers themselves, interaction with the cabinet, and interaction with Ministry of Health, Research, Agriculture, Interior, Foreign Affairs, and others. The second one is that it is really crucial to establish long-term collaboration between all the stakeholders to build trust. Even if you need to keep independence, trust should be there. Then again, multidisciplinarity, it was already said several times this afternoon, but this is key to anticipate the risk. And we were really delighted to have also representation of health democracy in our committee to facilitate the understanding of our opinion and the communication of our opinion to the public at large. Then we need independence and ability to take action on our own, because if not, you are not able to anticipate. We also need to consider the specificity of the different regions in a country. And the last one, which is the most difficult and which was not implemented so far, we need to implement a clear mechanism for monitoring and evaluation of the recommendation and the way they are taken by the government. Thank you.